What makes Vascular International stand out is that it has a lot of familiarity and tradition within. It's been a course since over 30 years already, and the surgeons that I work with, they refer to the times when they went to Vascular International, so I think that's a very nice thing about it.
I think Vascular International succeeded to be truly international. So, for instance, in this course, we have participants from Middle East, from South Africa, from the UK, from Finland and Sweden.
The networking opportunities providing during the course are another good feature of the course, because I got to meet a lot of people and I got to learn about their vascular departments.
My colleagues told me this is a very good and helpful course, even for general surgeons. So I work in general surgery. When I have a damaged vessel in my operation field, I want to be able to repair it.
The elements that differentiate Vascular International with the others simulation course is the quality of models and also the quality of teaching.
Every participant is a very nice story, a success story, because you see them make progression from the first day to the third, and they all come out a lot more skillful than they started.
The 4:1 ratio allows us to take a personalized approach. You have the opportunity to participate or to actively correct someone if they make a mistake or if you want to add something to their technique.
You get in contact with them right at the beginning. You get to know your participants, so you talk to them, you get what do they expect from the course. Therefore, I think you can teach them a lot more personal, and therefore they can take the most out of everything we do within these days.
Even we as tutors learn each time. And that's exactly the point. Not just we are learning, those who are not experienced learn even more.
There are a lot of mentors for such a not really big group of people, so you get the best vascular surgeons in Europe to look directly at your work and to give you different recommendations, not only one tutor, but more than 10 people.
The most valuable aspect for me was the hands-on practice. That is something I can never practice, and just the assistant of the doctor, of the surgeon, so that's not something I can do very often.
Here we have the opportunity with the dedicated technicians of Vascular International to provide high-fidelity simulators.
It's really the closest you can get to a live case. The models are really well designed with the thrombus and the plaques, so you can really do the whole procedure as you would in a living patient. And
working with simulators has enriched the experience to being able to practice without the pressure on practicing on a living patient in an operating room.
I would encourage everybody who's aiming to go in any surgical field to pass these basic techniques courses, and then of course with interest to advance through the specialized courses.
I would definitely recommend Vascular International to my peers. It's absolutely the best.